My MegaMart, best value by far. Get more with your membership card. Best value by far. Get more with your membership card. MegaMart, best value by far. My MegaMart, best value by far.
Hello.
Hi.
How we doing? It's great to be back here. What's up, Kim?
On our lovely set.
Yes, we have nice set again today. Oh, now,
So I can take it home with me?
You know what? Yes, you can. And since she just spoke before we even introduced her, Kim, do the honors, please.
Right, so of course this is our breast cancer awareness episode. We have a wonderful set today. So we're all in our pink,
Yeah.
even my shoe. And we have lots and lots of special guests who are going to share with us. And our first guest is Dr. Kathian Pate Robinson. And she's just going to share with us a little bit about breast cancer. And I think probably the first question is, what is breast cancer?
Yes.
Thank you guys so much for having me.
It's a pleasure.
In terms of breast cancer, cancer is what happens when cells that are in our body stop listening to the cell signals that tell you, okay, now it's time to be born, now it's time to die. So the cells stop listening to when they are to die and they become what we call immortalized. They keep going and they keep multiplying because all our cells multiply to keep those cells available, but usually the old ones die and new ones are born.
Okay.
So then in cancer, the cells don't die and they keep going and then they form a mass of tissue which you would call a tumor, which usually starts as a small lump that you can't see but will grow over time, and
Okay.
with some cancers will spread to different parts of the body. So for breast cancer, that happens starting
breast
in the
tissue.
breast tissue itself, starting from breast tissue cells, and then can eventually spread to the whole body.
Okay. We encourage women to do a breast self-examination. So
Right.
what are, during your monthly breast self-examination, what are some of the symptoms that would prompt you to say, let me go visit my doctor?
So, in general, early in cancer, you may not find signs, but there are a lot of things that you can look for that will happen still relatively early. So, there are skin changes that can happen. You could have redness, you can have swelling of one area of the breast or multiple areas. You can have an obvious lump or bump.
Right.
Okay.
Sometimes you can have what they call dimpling, where you almost have a little pulled in area of the skin. So
Yeah.
instead of a stick out, there's a stick in, there's a little pulled in or depressed area.
Right.
And you could have nipple discharge, you can have pain,
Right.
either in the nipple or other areas of the breast. You can also have swellings of the lymph nodes under the arm, what people in Jamaica usually call wax and canal. you
Yes.
know?
Right.
So you can have those lymph node swellings or enlargements as well. And all of those things are possible if in an early stage.
Yes.
If you ignore those signs and the breast cancer becomes well established, some people will develop other problems where they can then have a lump turn into a sore that can open up
Right.
on the chest. You can have spread to other organs of the body, which can cause difficulties with function of different organs. So sometimes the liver function isn't as good and you might turn yellow because you're having jaundice.
Right.
So there
Yeah.
are a wide variety of things when it gets to a far stage. But in the early stage, it tends to be changes in the breast area itself.
I'm glad you pulled me back because a lot of times the fact is a lot of women just don't know. I mean, breast cancer seems like it's kind of like a silent killer for some women, which is why they encourage women to literally feel up their breasts. In fact, there's a new ad out was saying that, in fact, you should encourage your husband or whoever that person is to feel up your breasts some more because I read somewhere that a lot of breast cancers are actually found out by the husbands or the partner of these women who actually are enjoying enjoying their partner's bodies and something feels strange here.
I'm happy you said that too because Kathy, you mentioned before about lumps. But
Right.
some women naturally have lumps in their breast. So it's when you notice a new lump or different. It feels different to you.
Yes.
Which is why we
Because there is
recommend-
breast tissue, natural
Right,
breast
right.
tissue, right?
Right. So a lump may not be discrete. It may not have a smooth surface or a distinct edge. It may be difficult to tell from the surrounding breast tissue, maybe because it is attached to it. And that can sometimes be a sign that it is invading the surrounding tissue or spreading.
Okay.
And that is more characteristic of a cancer type lump as
Right.
opposed to maybe a lymph node, which is sort of rubbery and roundish and
Right.
a bit soft but a little bit firm.
Okay.
So everything depends on what the characteristics of the lumps are.
Right.
And then you also look at size, because a larger lump is more significant than a smaller one.
Right.
So at this point, a mammogram would be recommended?
So yes, a mammogram is the first best screening test that we have.
Okay.
A lot of women are not happy with it. They consider it less than ideal because it can be uncomfortable. And if you are a woman who has tender breasts, it can be a little painful. But other tests don't always give the same quality of information. So some women will have a mammogram and they decide, okay, I'm not doing that again, it's too uncomfortable. And they say, okay, next time I'll do an ultrasound. But an ultrasound can't really show the level of detail of
That
the
a
breast
mammogram
tissue
shows.
as a mammogram can. And an ultrasound might miss a suspicious lump because it doesn't look as different on an ultrasound as it would on a mammogram. And some women, because they're younger, especially less than 40 years old,
Yes.
the breast tissue may be dense and fibrous, and a mammogram alone may not be enough. And the doctor may say, okay, you need a mammogram, but you also need an ultrasound.
Just to
And
make sure.
to make sure that you are getting
A
a
clearer
better
picture.
idea of what's there. And if that is not sufficient, sometimes we even move to an MRI or magnetic resonance imaging of the breast,
Okay.
which is a little more pricey.
Rest.
But that gives you the best differentiation of the individual areas of tissue within any part of the body,
Okay.
including the breast. So if an MRI is done, then that's the best image that you can get. But because it's more expensive and less available, then you would usually go for a mammogram first.
Right. So only if there is something that you are not clear about.
Right.
In that case, a doctor would probably recommend an MRI.
Right.
Okay.
In most instances. It depends on what your level of risk is. Again, because mammogram is a screening test in somebody who may be at risk or is considered at risk, depending, despite the level of risk that you might be at.
Okay.
Right.
But if you're thinking about somebody who, okay, you're my sister, you're my auntie, you're my mother, all of you have breast cancer, my
You're
risk
at a
is
higher risk.
higher.
Because
I may have
family
cancer
history.
genes.
Right.
Yes.
And then I should probably be getting genetic testing done, which is available in Jamaica. To actually get the test done, you can do it here and
Right.
it's a send away test overseas.
Okay.
But you can get genetic testing done, and then the recommendation for screening might be more advanced. You might say, well, your risk of breast cancer is higher. You may need to do a breast MRI every other year or
Okay.
every year because your risk is higher than someone else.
What's the general advice to females? I mean, at what age would you recommend they start doing, testing and
That's-
ensuring that they have,
I
they're
think
safe?
that depends on your risk. But
Well,
generally is age 40.
For the average woman, age 40 is the latest you should start screening
Okay.
with your mammogram.
Okay.
But if you have a close relative who has breast cancer, especially in the earlier ages, 20s, 30s, 40s, then you should start screening earlier. If you have more than one relative with breast cancer, you should consider getting genetic testing to know, do you have a breast cancer associated gene that would put you at more risk? Because then once you know that, the screening recommendations change based on what you have.
Okay.
And we do have families in Jamaica who have different types of breast
History.
cancer genes.
Yeah.
Yeah.
Wow, this is such a large discussion. I wish we
We can
actually,
stay all day.
had the entire half hour dedicated to this discussion. Where can one get in touch with you to find out more? Our viewers may want to give you a call. How can they reach you?
Well, I work at Island Medical Specialists once a week, which is on Beverly Vale Road. It's online, so they can always look on the website.
Okay.
And any internist, any general practitioner should be able to advise you. So if you already have a family doctor, you can go to them and get some advice. And there's a Jamaica Cancer Society. They do a lot of screening and they have a lot of resource persons available there as well. So there's a lot of information, a lot of help available.
Okay.
All right,
Thank you so much for joining
You're
us.
most welcome.
Yes. Thanks, Dr. Robinson. We have much more coming up here on the MegaMart Shopping Show. We're inside Waterloo location and it's a buzz in here, so
Yep.
you will hear some distractions, but you know, that's what we do. We try to give you the information while we work. Thanks again for coming through.
You're most welcome.
Absolute pleasure to have you. We'll be right back.
Welcome back, guys. So we are here with Miss Andrea Murphy. She's our chief pharmacist here at MegaMart Waterloo Road.
Mama Murphy.
Welcome.
How you doing?
Thank you very much.
Well, it's good to have you outside of the pharmacy today,
For a change,
right? For a change. don't
You
you?
know, only know me
Behind
from
the
here.
counter. Alright, so, Miss Murphy, talk to us. What is a pharmacist's role in helping a patient with cancer?
Okay, we know that being diagnosed can be a very devastating experience. So at MegaMart Pharmacy, we are here for our customers. What we do is we lend support. We are here to listen. We are here to be confided in. We are here to empathize, and we are here also to be a shoulder to lean on for our patients.
Right.
In addition to that, we also offer drug therapy advice to our patient. We counsel them about their medication. We tell them about the side effects that they should expect. We also tell them about interaction with other medication that they may be on now, about over-the-counter medication that they're on that they should not be taking while being treated, about some foods that may interact with their medication as well. We do tell them about that. And we prepare them for the treatment and let them know that it may be devastating in terms of side effects, but it's important to stick with the medication, stick with your therapy in order for you to be cured.
To heal
of this.
better.
Right.
Yeah,
to heal better.
you guys have such an integral role to play in helping the psychology of the
Right,
patient to get
exactly,
better.
exactly.
Because you know people are with medication. Some people might be diligent with it, but others may not
Right.
be. You know?
So we have to emphasize that even though it's a traumatic experience,
Yes.
it's important to stick with your medication.
Talk to me about the hard to reach medication. I know that sometimes, you know, as a pharmacist, you really have to sometimes dig in deep and help that
Go the
patient
extra
and their
miles.
particular right. Because
Yes.
there's different types of cancer.
Right.
Yeah.
So
what we do is we source the medication for our patient. The difficult to find medication, we know it's a traumatic time. We know our patients are in stress with their illness, so we don't want to give them additional stress to be hunting medication. So we'll source your medication once it's available locally
Yes.
for our patients.
what about if it's not available locally? Would you try? I mean, as a pharmacist, would you try to reach out or?
Well, it depends because some medication has to be registered in the country.
Okay, right.
So
we'd
in
have
that
to-
case, you
for it
have
to be
to reach
available.
out to like a supplier.
Right, we'd have to reach out to a supplier to find out if there's any way that they could bring that medication in for our patients.
Yes.
What about improving the convenience for those patients, like reducing the wait time for them? Is there anything in
Sure,
place?
definitely. We do have we have a WhatsApp service. We have email service. We also you can fax your prescription, and what we'll do, we'll follow up with you. You instruct us as to what to do in
Oh,
terms
really?
of what, right?
So I don't have to wait? You're saying
No.
I don't necessarily have to come in and wait?
No, you don't have to wait. So once you instruct us, we go ahead. We'll fill your prescription.
Right.
Then we'll inform you when it's ready, and then you'd come in and you'd pick up. We just bring your original prescription along with your health card,
Yes.
and minimal waiting time drastically cuts down on your waiting time.
That's really convenient, especially
Yes.
during that stressful
Exactly.
time.
Right. So-
It's good to know that you can just come and
Right.
so the convenience of it.
we do go above and beyond for
Yeah.
our patients' convenience.
In addition to that, I mean, if you're shopping, you could probably just leave your prescription by the
Right.
pharmacy.
That's right.
You know, when you're
That's
finished
right.
picking up your groceries,
Yes,
it would be
That's
ready
my
at
kind
that
of
time.
style. Something like that
That's
would
his style.
Okay.
You guys work long hours. Awesome time to read these very hard to read signatures. I don't know how you guys do it, but you're trained obviously to do
We're
that.
trained to do that, and it comes also with years of experience.
Right, right.
I'm happy
Yes.
you mentioned that. How long have you been with us here at MegaMart?
Well, MegaMart Pharmacy at Waterloo is my baby. I started that pharmacy 15 years ago,
Wow.
right? And I've built it to where it is today.
Awesome. So of the 20 years that MegaMart's been around, And this is
15 years.
15 years here.
Oh, yes.
And
Yeah.
I'm told this branch at Waterloo is 16 years old. So
Yes.
you've pretty much been here from the start.
Right.
Awesome.
In
Thank you
addition
so
to
much.
that, though, like just before we go, I know that cancer can be really taxing on the pocket.
Right, yes.
Is there anything that we do special here that to help accommodate those patients?
Good question.
Sure, we accept all major health insurances. We accept the NHF, JADEP, which are the government-funded cards. We accept the Sagicor, Guardian Health, and there's a new kid on the block, Canopy Insurance. We accept
Right.
that one as well. And what we do, persons have multiple health plans, so we combine
Right.
the insurances, we combine the plans to cut down the cost.
Yeah.
Wow.
And in addition to that, we offer 10% discounts to persons that are 55 years and older.
Oh,
Awesome.
so Christopher, you'll get a discount.
I know. And that makes
Sure,
me,
come
I'm
along.
going to go back to my other branch to find out if the pharmacist at the other MegaMart branch has been giving me my 55.
Yeah, you should,
kidding,
you
I'm
should.
But
kidding.
10%.
Well, thank you so much
Right.
for
Thank you
joining
so
us,
much.
Miss Murphy.
Sure, so-
it was a pleasure to have you.
Right, so
I'm going to bring you back on set again.
Definitely.
You deserve to
So-
be back on the set.
Right.
Appreciate
So we welcome our clients, and
Yeah.
once you use us, you'll keep coming back. We are addictive in a good way.
Oh,
Yes.
I like
So
that.
we'll just continue to offer the best care by far.
Thank you so very much.
Thank you so much, Miss
You're
Murphy.
welcome.
MegaMart Shopping Show continues, guys. Hey, welcome back. We're joined, of course, by two ladies who can tell us a lot about insurance and critical care coverage and individual care coverage when it comes to cancer. Of course, we have Alison Dixon from Guardian Life, and we have Audrey Wilson as well from Guardian. Welcome, ladies.
Thanks
How you
for
doing?
having us.
Good.
All right, so we're talking about care and coverage. Critical care, is that what you would call cancer coverage?
Yeah, it really falls under a critical illness plan. And we offer those plans based on a group plan basis as well as an individual basis.
Right.
Now, for the group setting, you can apply for it based on if you're diagnosed
Right.
for 4 critical illnesses in one instance. If it's a heart attack, a stroke, burns, cancer. That's plan 1.
Right.
On the other option, we are covered for 14 different illnesses, inclusive cancer, stroke, heart attacks, multiple sclerosis, burns, loss of hearing, things like those. And of course, upon diagnosis and on presentation of medical supporting documents,
Right.
we will pay a lump sum with a minimum of $500,000 to $1.5 million.
Why is it so important for the average person to have coverage, whether it be critical group coverage or individual coverage for cancer or illnesses like that, like cancer?
Well, as you know, these illnesses are termed catastrophic illnesses.
Right.
They are life-changing illnesses. And so we encourage our members to take out these different types of coverage because you want to have something in place should something occurs.
'Cause they're very expensive to treat.
It's very expensive to treat, and you wouldn't want to be going into your personal savings to be drawing down on it just to take care of your this financial burden that it may
Because the
very
truth
well
is, they're
amount
so
to.
expensive. The average Jamaican probably can't afford to do that, right? To go into your pocket and find the money to treat cancer, which is something that's the doctor admitted earlier that it's very expensive. So I'm assuming it is.
It is. It's a very expensive venture. And of course, when you're ill, you know, Johnny, you don't want to be thinking about your finances or the lack thereof.
That's right.
Right? So
That's right.
once you have this plan in place, once the lump sum is paid out, you have access to the funds, you can
Right.
pay for your treatment, you can pay for in-hospital treatment, your aftercare treatment, nursing services are available,
Yes.
you can pay for those, your prescription drugs,
And all
of
those different things.
all of these important components of your treatment,
Costly.
which of course, as we have said before,
Yeah.
very costly, and so you can draw down on those funds.
I'm happy we have you here, Miss Wilson, because you are, of course, had cancer. You are a cancer survivor.
Yeah.
And you also, of course, work closely with Alison to ensure that you are here with us talking now. Can you give us your story in terms of how much having coverage assisted you through your struggles?
I'm happy that you asked that question because so many persons think that this can't happen to me. I don't need this coverage. But first, I must say, no one is excluded. And one of the most beautiful things that you want to have is after you have had that sad diagnosis, somebody is your financial controller. And having a financial controller in an insurance company means that we would have vetted the report that you sent in and would have paid out all the monies that you need. Now, treatment can run from anything. There was a medication that I took that was $384 or $384,000 for one.
For one?
For one, I needed 8.
Wow. What was the cancer that you were diagnosed
I was diagnosed with stage 1 lymphoma.
Okay.
B-cell lymphoma.
Stage 1?
Stage 1. And for 14 months, my medical bill was $7.6 million. Do you have that in your pocket, Johnny?
No at all. I wish in the pockets. So,
and even if you had?
Even if I had that, it would have been difficult to
you
take it
want
out.
to have to send. So having an insurance benefit where somebody is your financial controller, that's a big thing. Each individual must. Because one of the beautiful things about it is, say nothing happens to you.
Yes.
At age 75, we refund every single dollar that you have paid from inception. So we're covering you in the event of.
Yes.
And if nothing happens, hello, here's your money back.
Awesome.
What more could you ask for?
I'm so happy that you're here with us. I'm happy that you've survived. She's a powerful woman,
Yeah, man.
Miss Wilson, and her story must be told. But Alison, what's your advice to the general public before we wrap the session up about insurance, and particularly those women who have a family history of cancer? What's your advice to them?
I would encourage every single person out there to take out a critical illness plan, because we're dealing with breast cancer awareness,
yes,
but there are other types of cancers,
obviously.
right?
Exactly.
And so we have individual critical illness plans, which the coverage is much higher than we offer in the
group
plan basis,
okay,
right?
Yeah.
And so, well, it's subject to a little bit more scrutiny because they're individual plans, but the coverage can be more,
right,
and much more. And once you have something like that in place, you can live with peace of mind.
Peace of mind. Check them out, family. They are from Guardian Life, and I'm sure you'd want to guard your lives, right? Alison Dixon, Audrey Wilson, thank you very much for joining us on the MegaMart set.
You're more than welcome.
Thank you very much for having us.
It's been a pleasure.
Welcome back, guys. So to close out the show, we have a very, very, very
Be
special
beautiful,
guest.
be powerful.
Thank you.
One of our very own.
So welcome to the set. This is Charmaine Ferguson, and she's one of our assistant store managers here at MegaMart Waterloo.
Yes.
And most importantly, she's a breast cancer survivor. Double breast cancer survivor. So you are nothing short of amazing. Like, amazing is an understatement right now.
God is good.
God is good.
God is good.
The God is good.
Yes.
I mean, where to start, Charmaine? I think we'll start with the beginning. How did you feel? First of all, how did you find out? How did you find that you had breast
I
cancer?
found out after one of my co-workers found hers.
Right.
So I started to check myself, and I realized the first time I checked, I felt something. So I went to the doctor,
Right.
and he said he didn't feel anything, but I kept feeling it. So I went to a different doctor. So he didn't feel anything, but he sent me to do an ultrasound. And when I did the ultrasound, they saw it.
Right.
Yes, and I did a mammogram the same day, and they saw it in the mammogram also. So that's how I found out.
I think you said something very, very important. The doctor didn't feel it.
But you felt it.
I felt it.
And I
yes.
think that points to trusting your own instincts
Right.
and knowing that you know your body and you know how you should
And
feel.
nobody know your body like you.
Exactly.
Right,
So there's
because-
nothing wrong with getting a second opinion.
Right, because I didn't feel it in the other breast, and I said, something is wrong. Why am I feeling it here and not here?
Here, right.
You know, so I said, let me check it out.
Yeah.
Right, so second doctor said, no, go and do an ultrasound just to make sure.
Right.
And that's what we did.
So you found out.
I found out.
And what did that do to you?
When they called me for the results, I was shocked. Because I didn't want that result, because breast cancer killed my mommy when I
Nobody
was
wants that
8.
result. Right, okay.
So I didn't want to hear that. But I heard it. It was shocking. I cried, and by maybe a couple of days later, I decided I accept it. And I said, I have to deal with it.
Yeah.
Anyway, I have to deal with it. I just have to deal with it because it's already there. So I did my surgery and I got chemotherapy. And I found out after a couple of months what caused the cancer. Because sometimes you know and sometimes you don't know.
Right.
Okay.
And it was an estrogen, excess estrogen that my body was getting.
Okay.
So that is what caused it.
You see, there's a lot in her story here. She mentioned her mom losing her mom at 8 years old, and that suggests that there's a family history
Right.
there. Was that part of the discussion with the doctors as well?
Yes.
Yes.
Yeah.
So you,
I think one of the important things that you said was you didn't want to get that result. So I know that we may be running out of time, but I wanted you to give advice to somebody who may be watching at home who know that they probably should go and check because they probably have family history as well, but they're fearful of hearing that positive result. What advice would you leave them with?
Well, I would tell them to go, ensure that you go and check it, because if you get it early, you can live. If you get it early, you can live. But if you keep it there, it's gonna go spread and get bad and get worse, and then and it can spread to your brain, it can spread to different direction, your liver, whatever, and you die. And then I just want to give you a little piece of the second one.
right? Because I mean, did you remove it at the same time, or you decided?
No, it was a couple of years after. I keep on doing my checks on the other breast, and then I did a check. I didn't hear from the doctor. Normally, when you don't hear from them, you get comfortable. So one year, my doctor said, "Go and get the result." My personal doctor sent me to the surgeon to get the result from the test that I did, and they had the result from the year before, and it was cancerous,
Wow,
and they
and you
didn't
didn't say
call
anything
me.
to
So 1 year, so I had to rush again to get the other one off.
So it also speaks to you being proactive.
Right.
And in taking action as well, quick action to ensure that you can save your own life.
Yeah.
Because these doctors do have multiple patients and they have their own lives as well to deal with from time to time.
Yeah.
Did you have to do a partial removal or you had to
Full.
remove?
Both of them were full removal. And for the first breast, I took 22 lymph nodes,
Right.
and 3 of them were infected.
Right.
And for here, they took 15, and none of them were infected. So I didn't get any chemo for the last one, but I got chemo for the first one.
What has life been like since? I mean, because you said you accepted it, which is important to accept.
Life is great. I can live without breasts. It doesn't make me do anything different.
Yes.
Apart from maybe changing my diet a little at times. I'm still greedy, I eat enough same way. And you know, but it's good, and it's good to know that God is there, God is good, God is with you.
Yes.
You get your healing and you over it and you move on with life.
And let me tell you, she's still full of life. She's still the boss around here, still pushing and shaking things up for MegaMart, and still contributing very positively to this.
I think those are powerful
yes,
words.
very positively here. And we want to thank you for being brave to not only face your own issues, but being able to come and tell your story.
Share that
right
story
here.
with us.
Thank you very much.
Thank you.
Love. Thank you so much.
We had a wonderful show today. I think we could have gone for an hour.
Yeah, it's a difficult topic to deal with in half hour, particularly when you have people like, you know, a survivor here to talk to. And what I'd say to our viewers is, you know, you have to fight, you have to live, but you have to, you know, be positive about it. I think Miss Wilson said it best offset with me. She said, your word, your soul, and your power must be positive.
Yeah.
And that will continue to drive you. So, you know, on behalf of all of us here at MegaMart, including our very own
Miss Ferguson,
breast cancer survivor here, Miss Ferguson, we want to say, keep up the good fight. You know, do the checks, the necessary checks that you need to do to ensure that you preserve the one most valuable asset that you have, which
yourself.
is life.
Yeah. And of course, early detection is your best defense.
Yeah. And we have the medication right here available at MegaMart Pharmacy. And we have the perfect people to take care of you and to give you advice. So come on down.